Hello everyone, my name is Eve Rodriguez and I did this week's discussion post on atypical anorexia nervosa. What is atypical anorexia nervosa? How is it different from anorexia nervosa? Anorexia nervosa is an eating disorder that is typically characterized by abnormally low body weight, an intense fear of gaining weight, and a distorted perception of weight. People with anorexia place high value on controlling their weight and shape, and they use extreme efforts that tend to significantly interfere with their lives. Atypical anorexia nervosa can have the same definition. However, patients with atypical anorexia nervosa have a, quote, healthy, end quote, weight for their height, and there aren't many visible symptoms. The difference in this is that they've lost a significant amount of weight at an alarmingly short amount of time. Some of the physical and symptoms and potential dangers of this disorder are fluctuations of weight. Many people suffering from this disorder may start off as having an above average weight and undergo dramatic weight loss, yet still be what is considered a normal weight. Nutritional deficiencies. By severely restricting their food intake, sufferers of this disorder are more likely to have nutritional deficiencies or, in severe cases, malnutrition. This is true even if body weight is above or in the normal range. Dermatological complaints. Abnormally dry skin and membranes, discoloration or molting or mottling of fingers and toes due to poor circulation, lango hair growth, brittle hair and nails, cardedemia. Other symptoms of this disorder: a weakened immune system, loss of menstrual cycle or stunted puberty, low bone density, low heart rate or sudden rise in heart rate, low blood pressure, low blood cell count, chest pain, dizziness and fainting, and constipation. Some of the behavioral and emotional symptoms: food restriction and food rituals, or preoccupation with weight and food, compensatory behaviors, strict and excessive exercise regimen, binging, purging, and or using laxatives. Dressing in layers. The body needs to burn a certain amount of calories to maintain a comfortable body temperature. Even a mild caloric restriction can significantly lower body temperature, meaning those with AN tend to feel cold most of the time. So, social withdrawal and suicide ideation. The risks of atypical anorexia nervosa. Atypical anorexia is dangerous because it's often not recognized. Families and even doctors may be praising this young woman for impressive weight loss when she's actually critically unwell. Atypical anorexia patients have the same symptoms and behaviors as typical patients, except the most visible one: low weight. Researchers have found that they were just as physically compromised and as distressed emotionally as their typical counterparts. Both are driven by an obsessive fear of weight gain and being fat. But atypical anorexia patients have significantly higher levels of distress related to eating and body image and a fear of fatness that their weight history might explain. The treatment options for this disorder are as follows. The first priority is to restore weight gain, to restabilize her body so that she can begin having her period again. However, that would mean moving from what would be normally a healthy weight to one that is usually considered overweight. These are difficulties that face the girl, her family, and the doctor who's treating her. Once a patient has stopped weight loss and stabilized medically, a clinician would encourage her to work towards weight gain at a much slower pace than one would with a typical anorexia patient. The goal would to be stopped as soon as menstruation is restored. Other treatment options would be inpatient or long-term outpatient care, psychotherapy, cognitive behavioral therapy, acceptance and commitment therapy, and etc. And this is my works cited. Thank you all for listening.